At Granger, we're for the ones who specialize in saving the day and for the ones who've mastered the art of keeping business moving. We offer industrial-grade supplies for every industry with same-day pickup and next-day delivery on most orders, all backed by real people ready to help. So you can get the right answers and products right when you need them. Call, clickgranger.com, or just stop by. Granger, for the ones who get it done.
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, Eric Christensen. Thank you so much for listening. Greatly appreciative to all of you who have shared the podcast with classmates, students, friends, other healthcare professionals to help grow their knowledge, background, and their skill set surrounding the use of medications. So please keep sharing if you enjoy the podcast and feel it's relevant and beneficial. I'm greatly appreciative of that. So let's get into it today. Probenecid is the drug I'm going to talk about, and I approach this drug cautiously. The title of my podcast is obviously Real Life Pharmacology. And I try to bring to you stuff that's used in clinical practice. Now, I will say I have seen probenecid used in clinical practice. I would say it's maybe 5 or 10 times at most in my experience. Usually it's been patients that have been on it for a long time. It's been helpful for them, or they've had an allergy or intolerance to other gout medications. So probenecid primarily is going to be used in the setting of preventing gout flares, okay? Not the treatment of an active gout flare, but prevention. And it does that by lowering uric acid, okay? Uric acid is one of the major components that we worry about in patients with frequent gout flares. There is one other indication other than gout that I have seen suggested, and that is to increase concentrations of penicillin antibiotics to enable them to have better effects, basically, on treating an infection. Never seen this done personally, but I have heard of it before there. So just wanted to throw that out there for completeness sake. All right, so mechanistically, how does this drug block uric acid? So if you remember back and go listen to allopurinol, I talk about how allopurinol works to lower uric acid. Probenecid works by blocking reabsorption of uric acid basically back into the bloodstream. So instead, it goes out through the kidney and out into the urine. That's how it lowers uric acid levels in the blood. From that, lower uric acid levels, we are going to help hopefully prevent gout flares as we drop those uric acid levels. One downside to probenecid compared to allopurinol is it is dosed twice daily. Maybe not as effective, again, depending upon dose and other things, but one of the big things there is it is dosed twice daily, so that's a little bit of a downside. Adverse effect profile, pretty well tolerated typically overall, I think. GI upset is probably the most common issue you might come across if you see this medication. But again, if a patient's been on it for a long time, and tolerating it fine, that may not be an issue. But upon an initiation or increase, keep an eye out for GI upset. You can give this medication with food if need be there. And that certainly may be recommended in a patient where we're having some GI upset. One other concern, adverse effect thing to look out for is if a patient has uric acid stones that regularly form, or they've had an issue with that in the past. if you increase uric acid out through the urine and we're forming stones in that area, well, sending more uric acid or having uric acid-based stones may worsen that. Probenecid may worsen that condition. So that's something we need to keep in mind there as well. It's going to pull it out of the bloodstream and put it into the urine, which could be a bad thing in that particular situation. So if you've got stones forming, remember, and that uric acid is a problem, it is recommended to make sure we're doing adequate hydration, fluids, things like that. That can obviously help dilute out some of that uric acid and maybe keep that flow going so a stone can't precipitate there. G6PD deficiency, so glucose 6-phosphate dehydrogenase deficiency. If you remember, there are a couple other medications, and I think I've covered maybe one or two, that if a patient has this deficiency, we are at particular risk for certain conditions, and that condition is hemolytic anemia. I do remember, I think, maybe some pharmacology exams in the way past or something, that coming up on an exam for probenecid. So definitely something to look out for if somebody's got glucose 6-phosphate dehydrogenase deficiency. Monitoring parameters with probenecid. So the first thing I think about is we're going to monitor uric acid levels. In most patients, we're probably going to target a level of less than 6. In some patients that maybe have very, very severe gout, maybe they've had issues come up at levels around 6, maybe we'd shoot for a lower target, but I would say in the majority of patients, usually our initial goal will probably be less than 6 milligrams per deciliter for uric acid. One other important factor in probenecid, and one of the big negative things with it and why it's maybe not used, in addition to that twice daily dosing, is renal function. So this drug needs the kidney to be adequately functioning for the medication to work and get that uric acid out through the urine. So that's an important thing to remember. If a patient has stage 3, stage 4, stage 5 severe significant CKD, probenecid isn't going to work as well at lowering uric acid levels. So very, very important to watch out for that. And, in our patients that maybe have been on it for a while, if they do have hypertension, diabetes, and you see that kidney function slowly declining over time, that could potentially be a concern with probenecid use there. So definitely something to keep in mind and pay attention to there. All right, so let's take a quick break from our sponsor and we'll finish up with drug interactions. If you're in the market for board certification study material, definitely go check out meded101.com/store. That's meded101.com/store, STORE. We've got BCPS, we've got NAPLEX, we've got ambulatory care, MTM certification, geriatric certification study materials. Definitely go support our sponsor, meded101.com. We also have books on Amazon as well. There's links to those at that web link, meded101.com/store. So go check that out. Support the podcast, help keep it free for all those to enjoy and benefit from. So with that said, let's finish up on drug interactions. And I do want to mention I've got a brand new book out, which you can find at the meded101.com/store link. That is Clinician's Guide to Drug Interactions in Primary Care. So definitely go check that out. Over a 200-page book on drug interactions and strategies on how to manage and that sort of thing. So with that, let's get into probenecid drug interactions. And the overwhelming majority of drug interactions with probenecid are going to be involving drugs that are primarily renally eliminated. Now, the clinical significance and how much it changes concentrations probably is going to be debatable based upon the drug and the situation. But drugs like penicillin antibiotics, remember I mentioned at the beginning that there has been off-label use considered for that to actually raise concentrations. But along with that, we think of other beta-lactam type drugs, so cephalosporins, carbapenems, medications like that can all have their concentrations increased. So if you happen to see more adverse effects in a patient where you're putting them on an antibiotic like that, that could be anticipated if probenecid is actually raising some of those systemic concentrations. So definitely something to keep an eye out for there. Interestingly, acetaminophen can actually have its concentrations raised there. So, if you've got a patient with hepatic issues already, maybe raising that acetaminophen concentration a little bit could be a negative thing for them. So another one to look out for there. Methotrexate, NSAIDs potentially, the immunosuppressant MMF. So there are some potential alterations, some increases in drug concentrations of specific drugs there. So drug interactions are something to think about with probenecid. So keep those in mind. And on the flip side, I did want to mention that you got to think about some of these drugs that can increase uric acid. So, cyclosporin, tacrolimus, maybe more commonly thiazide diuretics like chlorthalidone and hydrochlorothiazide. Niacin can raise uric acid levels. So you've got to remember that some of those drugs will potentially oppose the beneficial effects of the probenecid. So with that, I'm going to wrap up today's podcast. Thank you so much for listening. I hope you found it beneficial. Picked up a few practice pearls here. Go support our sponsor, med101.com/store. Also, if you enjoy the podcast, leave a rating and review on iTunes. It's greatly appreciative to those of you who have done that already for sure. And of course, share us. Send an email to classmates, to students, other healthcare professionals you work with, and share the podcast with them. And hopefully they can pick up some practice pearls and help understand also what pharmacists and pharmacy can do here. So I'm going to sign off for now. Definitely go check us out at reallifepharmacology.com. Get that free PDF just for following and subscribing to our updates and when we've got a new podcast available and things of that nature. So go do that at reallifepharmacology.com. Get that free 31-page PDF of the top 200 drugs and clinical quirks and pearls that go with them. And you can find me at reallifepharmacology.com as well. Shoot me an email there. The social media platform I'm probably most active on is LinkedIn. So track me down there. Eric Christensen, PharmD, BCPS, BCGP. With that, signing off for today. Thanks so much for listening. Take care. Have a great rest of your day.
Okay, round two. Name something that's not boring.
A laundry? Ooh, a book club. Computer solitaire, huh?
Ah, sorry, we were looking for Chumba Casino. That's right, ChumbaCasino.com has over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.